Hello, welcome to this viewing of Spark, Robin Williams and his battle with Lewy body dementia. My name is Julia Wood, and I'm the Director of Professional and Community Education for the Lewy Body Dementia Association. Thank you so much for joining us. I would like to start by thanking Cindy Froning and Nadonna for the opportunity to share Spark and this information about Lewy body dementia. Also, a thank you to Acadia Pharmaceuticals for supporting the production of the film Spark. And last but certainly not least, a very special thank you to Susan Schneider-Williams for so graciously sharing her story with us all. So there may be some facts or statistics about Lewy body dementia that could surprise you. LBD is the most often misdiagnosed form of dementia, often taking an average of 18 months and up to 3 medical professionals to obtain a correct diagnosis. It is the second most common cause of progressive dementia after Alzheimer's disease. It's estimated that 1.4 million Americans are affected, mostly adults over the age of 50. And studies indicate that LBD is the most expensive form of dementia, almost double that of Alzheimer's, due to the significant symptom presentation with falls and psychiatric disturbances. So how exactly is Lewy body dementia defined? It is a progressive brain disorder that features abnormal protein deposits called Lewy bodies in the brain. And it was named after a neurologist named Dr. Frederick Lewy. And you'll notice here that there are 2 types of dementia that fall within the umbrella of what we consider Lewy body dementia. And they're separated only based on the timing of when the symptoms present. For Parkinson's disease dementia, the changes to movement occur first, and later on within the progression of the disease, you may see changes to cognition and progression to dementia. In the case of dementia with Lewy bodies, the changes to cognition occur first before the movement changes or in combination with the movement changes. So you'll notice there's a whole host of clinical features that make this a very complex and difficult diagnosis to both treat and diagnose. So we know that there are changes to cognition that can include disturbances to executive function, attention, and memory, changes and disturbances to sleep, autonomic disturbances such as disruptions to blood pressure and even bowel and bladder regulation, sensory disturbances, motor issues, including changes to balance, gait, and mobility. And most often, neuropsychiatric disturbances can be the most profound for individuals and families facing this diagnosis, as you'll see in the film detailing Robin Williams' journey. So it's important to note that there are some issues when we think about nursing home admission. So when we compare patients with mild Alzheimer's disease and dementia with Lewy bodies, they found that men with dementia with Lewy bodies had the shortest time to nursing home admission by almost 2 years. The duration of symptoms prior to diagnosis with dementia with Lewy bodies and the use of antipsychotic medications were associated with an increased rate of nursing home admission. And once admitted to a nursing home, dementia with Lewy body patients have increased mortality rates compared to those with Alzheimer's disease. And there's often a concern by physicians that their patients will not be medicated appropriately in nursing homes due to a lack of provider knowledge about specific sensitivities to certain drugs and medications that are part of the dementia with Lewy bodies disease process. So at LBDA, we are the only national organization solely dedicated to Lewy body dementias. Our mission is that through outreach, education, and research, we work to support those affected by Lewy body dementias. To find out more about our resources and education, please visit us at www.lbda.org. Thank you for your time and attention. We hope that you enjoy the film.